Well, we have heard from you that it's time for a refresher of sorts about coronavirus tests. So for this Fact Check Friday, testing truths.
There are two kinds of tests. Diagnostic, which tells you if you have the virus right now, and the antibody, which tells you if you've had it in the past. But there are actually three tests out there. According to the FDA, the diagnostic test is broken into two categories: a molecular test and an antigen one. Both are usually sampled using the nasal swab, but here's where they differ. The molecular test is highly accurate and usually doesn't need to be repeated. Results can come back in as little as 24 hours or up to a week or longer. The antigen test results can come back in less than 30 minutes. Positive results are usually accurate, but there are some issues with false positives, and a negative result may need to be confirmed by using a secondary molecular test, as they're more likely to miss an active infection. The antibody test uses a finger prick or blood draw. Many tests come back the same day, but sometimes a second test there is needed for accuracy too. The FDA says antibodies can take several days or weeks to develop after you have an infection, and also says the FDA cautions patients against using the results from any serology test as an indication that they can stop taking steps to protect themselves and others, such as stopping social distancing or discontinuing wearing masks.
Now, as we saw earlier this week, there are new diagnostic tests available. The FDA just approved an in-home test that's available by prescription. There are also saliva tests and a combination test that says it's able to spot influenza and coronavirus at the same time. Send me your concerns or ideas for Fact Check Friday to adrian.whitsett@wcpo.com.